But you have to think a lot about the strategic positioning of a new product and the people who, are going to be upset when you bring this product to market.
Hello, and welcome back to another episode of today's Medical Sales Leader. I'm your host, Claire Davis, and today I have someone remarkable with me on the show, and I cannot wait to tell you a little bit more about her. But before I do, welcome, Dr. Lebovic. It's so great to have you on the show.
Thank you, Claire. It's wonderful to be here. I appreciate you having me on.
Oh my goodness. I couldn't wait. I know I've seen you on a couple of other shows. You are everywhere on LinkedIn, on lives, online, on Forbes. And so I couldn't wait for my chance. But if I may, I'd love to introduce you and tell everybody here a little bit more about you, because you're a world-renowned surgeon, a visionary inventor, which we'll talk about here in a minute, and definitely a medtech entrepreneur. So it's a pretty powerful combo, as well as being the driving force behind Silicon Valley Innovations Incorporated and the creator of the revolutionary nasal cleanse. So I want to thank you personally for the nasal cleanse from the Davis household, because I feel like further health will be in our future because of your innovation. So thank you so, so much. And your journey from surgical excellence to innovation is really what I want to dive into today, because I think that it takes something really special to go from the clinical environment and then also pair it with this incredible business acumen and the vision that you have for these kinds of products. So can you tell us a little bit about maybe what was that initial spark that you started to think, I'm an incredible surgeon already, but there's something else that I want to do here. There's something that I have that I want to bring to market. Can you tell us about that kind of switch, that transition into your twofold role as clinician and businesswoman?
I will try. Thanks for that introduction. It's a little scary when I hear all that stuff. It makes me just think, oh boy. But it sounds like it was all very organized, and planned, but it actually wasn't. It really was not. It was just a very natural, organic thing. Started a long time before I was a surgeon, actually started when I was in medical school. And, those days we didn't have cell phones that we were running around with. We didn't have iPads. So we had little slips of paper in all of our pockets with all the patients' information, and we had to go around and we'd have to gather all the information. And I literally started by designing a pocket-sized notebook with little patient information cards. And it became really popular because everybody looked really organized and you had everything at your fingertips. And so we sold those. My dad sold them around the country out of his house. And that's how, I realized, wow, you could actually have an idea that's practical, that solves a problem, and you can create it and sell it. Wow, that's kind of cool. And it just became one after the next, after the next, after the next. So someone once said to me, actually, Dr. Tom Fogarty once said to me, I'm going to keep you close to me because I know that people who have ideas keep having them. And I thought that was so interesting. I didn't know what he meant, but it's so true. So that was how I initially started. But there wasn't really a switch from surgery to going into medtech. I did them in parallel. I was very fortunate. And it started when, again, I was at Stanford. So it's a very innovative environment, but this was back in the 90s and I was taking care of patients, like my favorite thing in the world to do. And I got a phone call again from Dr. Fogarty, and he said, hey, I know you're a breast surgeon, but do you have any ideas in women's health or in breast surgery? And I said, yeah, heck yeah. And he said, well, come to my office tomorrow. And I was like, okay. So we rearranged the schedule and off I went to his office. And that was kind of the beginning of 25 years worth of serial, entrepreneur ventures. It was just one after the other. So
Okay, so I'm
that's how it
dying to know
started.
what happened in this meeting. What happened in this meeting with Dr. Fogarty?
Honestly, I remember exactly where I was sitting because he
Mm,
was such an icon and such a legend, still is, obviously. And we sat at his little table and he's very quiet. He's very careful about what he says, but he said, I have an engineering team and would you like to work with us? And I said, yes. And the rest is like history. So I started consulting with one of the companies there and his chief engineer, George Herman. And they were a little bit in trouble where they were at this project. And so we just went to the whiteboard and started coming up with ideas and changing direction of the company for just mostly practical reasons that, later became very important.
mm-hmm.
And that company was very successful. And there's a big story behind really each one, to be honest.
Okay. Do you mind if we dive into this one?
Sure.
Okay. So tell us a little bit about, because you go in and you're fresh in this environment, right? You've got some engineers, you've got the visionary Dr. Fogarty's like, here, we're going to put this A team together.
Yeah.
And here you come with incredible clinical experience. And it makes me laugh a little bit that he's like, do you have any ideas on women's health? Because of course you do.
Hello.
So tell me about what was happening and then what changed and then what was the result?
Yeah. So I met with a team of 3 engineers, again, with a blank whiteboard, which is my favorite thing to do. And they told me about what they were trying to design. And I proceeded to poke holes in it. I'm not sure they were ready for my brutal honesty, but they got it
Sure.
and embraced it at the end of the day. And so, the issue really became one that I think is really important. They were looking at this and trying to solve a problem from an engineering standpoint. And from that standpoint, they had done a great job, but they were working in a vacuum without the clinical side. And on that clinical side, it's not just how a product will perform, anatomically, or if it involves radiation, how is it going to be for planning? It's also about acceptance, adoption. How will the patients view this? Will they want this in their body? Will they want to use it? Will they accept it when the doctor tells them they need it? So that's an important piece. And also physician acceptance and adoption. It's really challenging to bring new products. And when I say new products, I mean something really novel, that hasn't been done before. This particular project was an implantable marker after minimally invasive biopsy. So, yeah, are you familiar with that?
Yes.
Yeah. So before this, what would happen is they would take a little biopsy through a needle. And then if it came back cancer, we, the surgeon, wouldn't know where that spot was.
Right.
Big problem.
Sure.
Like,
Right.
hello, you can't feel it. You could see it on the x-ray, but it's kind of like, where do I go? And so we did all sorts of things to try to find those lesions, like wire localization and other complex things. But at the end of the day, people started putting clips in there. And, it was a marginal improvement because the clips would move around. So there's fluid in the biopsy cavity and the clips would move around. Sometimes they would spit out. And so what we did was we invented a clip that had a marker in it and was surrounded by collagen. And the collagen, when they inserted it into the little biopsy cavity, it would blow up, shoot, like that. And it would fill that space and it would hold it in place.
Yes.
So it was, simple, yet an elegant way to solve that problem. And ultimately, Johnson & Johnson bought that marker from us, and they still use it today. That was back in 1997.
Oh my gosh. That's
Yeah,
amazing. You know, it's such a clear, definitive result that the patient and the provider are going to get. But like you said, patient adoption and acceptance and physician adoption and acceptance are very different things. So can you tell us a little bit about maybe the tenuous conversation that now you're saying, okay, well, when it comes to physician adoption, it's going to be a fine line, of course, between, hey, what you've always been doing isn't wrong. It's just that there may be a better option that you can try. So what kind of things helped you navigate that conversation, and how did you end up deciding this is the message we're going to use when we talk to physicians about how this is going to be beneficial to them and a help rather than a call for fixing what they've always been doing?
that is a very astute statement. And, it's a nuance that a lot of people miss when they bring a product to market, right? Because you're going to step on somebody.
Mm-hmm.
Somebody's going to take it personally and they're going to take it like that. Like, what do you mean? You mean I wasn't doing a good enough job? And so it's something that I've learned over time, which of course you just figured out straight out of the chute. But you have to think a lot about the strategic positioning of a new product and the people who, are going to be upset when you bring this product to market. Sometimes it affects somebody's pocketbook, which is the hardest thing to do. For me, myself, I and my team, we really try to stay focused on just doing the right thing.
Mm.
And I have found that when you do that and you do the research so that people understand why you're bringing this product to them, it's a little bit of an easier path.
Mm-hmm.
And I also think you have to identify the benefits for everyone. Like, make it a win-win, because there always is a benefit. I mean, there should be.
Mm-hmm. Yeah.
If you're going to go through the trouble of, creating something, inventing it, bringing it to market, we want it to have a positive impact on the healthcare environment.
Mm-hmm. Mm-hmm.
And so we kind of stick to that and stay very focused on it. And it seems to work.
It reminds me a little bit about, and I know we talked about this briefly before we jumped on, but it does remind me of something that you talked about in a Forbes article not too long ago about your North Star and really the mission that you have with the overall impact you're making on the market here. So, do you feel like this product, right? This one that's right out the gate, it was absolute winner. Like, clearly it was an incredible help for women everywhere. Going through this biopsy situation. But do you feel like you had that North Star or that mission clarified before, or maybe was it after, once you started creating more and more products and then seeing seeing this mission form as you were building?
I think it's something that is part of me.
Mm.
I can't explain that part, but I've come to understand that looking back. Because people started asking me all the time, over and over, how do you do this? How do you do one after the other? And again, it's not planned. It just kind of happens because I absolutely love being able to create something and bring it to market. There's nothing like it. I love surgery. Amazingly, I love surgery. But this is different because surgery is a one-on-one interaction. You're helping one person, you're impacting their family. It's fabulous. And it's fun. Especially breast reconstruction is like amazing. But when you create a product and 100 million women use that product, it's a totally different feeling.
Wow.
Even though they don't know anything about me, I love that. So it's very cool.
That is, what an incredible feeling. So, so let me bring everybody up to speed. So most recently, you've got a product right now that is actually in the ENT space. So can you tell us a little bit about NasaCleanse and what that is? And then I'd really like to hear about how you pick a winning idea, because I think that for someone who has the vision like you do for products, I'd love to hear more about, how, hey, I'm coming from breast cancer initially in the medical environment, but I see that this could be an amazing option for people. This could be an amazing thing for people. That could be an amazing, and it's not you're not siloed. You really have such an expansive vision for these different products. So can you tell us about NasaCleanse, and then also how okay, I'm going to pay attention to this little idea and maybe not that other one?
That's a great question. Most of the products that I have done before were in women's health. They were not all in breast, interestingly enough, even though I started with that. I would, I'm constantly observing things around me and learning. I love to learn things, like I want to learn guitar.
Yeah. That's right. We might be having to find some electric guitars to send your way. I'll loan you this one.
So I love learning, and it stimulates a lot of ideas. So you're right. You have to kind of weed through all the ideas and think about them. I think a lot, but this one was very special. So back in 2008, in the hospital where I was doing my surgeries, breast, and this is where I met Keith Matheny, ENT extraordinaire.
Yeah.
Right?
Yeah.
Yeah. So his operating room was next door to mine. And so it's really kind of fun to come full circle. So back in 2008, there was a lot of talk about antibiotic resistant bacteria causing post-op infections, right? So I started learning about that because an infection after a breast reconstruction is disastrous. I started learning more and more about it. And this was methicillin resistant staph, or MRSA. And I learned that, guess what? It is colonized in the nose.
Oh, wow. Okay.
And about 40% of the world's population has it in their nose.
Oh, no. Like right now.
No, isn't that interesting?
Makes me want to run out and swab immediately.
Yeah.
Okay.
And I never really truly understood the connection. Like, okay, you've got MRSA in your nose. We have to give you vancomycin. We have to do all these things to avoid infection, blah, blah, blah. And after I sold my last company, it was a problem that was really bothering me still. So I started reading and researching about it. And I found, you know what? There's really not a good solution for this. However, small groups of physicians did recognize that it was coming from the nose. What happens is we touch our face at least 7 times an hour.
Yes, I can attest to that, especially having 2 small children. It's a lot.
So the bacteria and viruses obviously get on our hands, which is why washing your hands really does help prevent infection, because it's coming from here.
Oh, yeah.
Right? So we wash our hands, and I started thinking, but wait a minute, it's in our nose. And a small group, as I mentioned, of physicians, mostly orthopedic surgeons, have tuned into this, and they started treating the nose with antibiotics, which was not a good idea, because then they got other super bacteria. And so they now, in many places, I won't say it's standard of care, but in many places, they use betadine to prep the nose before doing orthopedic implants.
Interesting.
Very. That will reduce post-operative infection by 60%. Huge number, very effective. And I thought, wow, that is an area ripe for innovation. So I went to work, and my mind automatically drifts towards design, product design. It's just kind of where I go, but I'm not an engineer. So I just started dreaming things up, and I had a vision for what I wanted in my mind, and started working with my wonderful team of engineers. And it's fun to look back at kind of what they came up with and how we morph into what is the design in my head, which is this. I don't know if you've seen our little magic wand.
Yeah.
But that's it. And it's a long way from where we started. So it is fun to do that. Anyway, I started working on that and thinking, well, we should make a gel and make this just like a toothbrush so people could clean their nose on a regular basis, not to make the nose sterile, but to clean the nose, clean it from germs and allergens. And there's all sorts of junk that we inhale through our nose. You know, about 7,000 liters is inhaled through the nose a day.
Oh, wow. Yeah. That's a huge it's a huge filter we need.
It's a huge filter. And the nose is kind of overwhelmed these days with poor air quality, allergens, and all that other stuff, viruses, bugs. So we created an antiseptic gel to kind of decrease the load, the bacterial load, the viral load, allergens, all that kind of stuff in the nose. And then COVID hit. So I had no intentions, honestly, of doing another company. The last one was my 8th company. And it was, you know, really a great experience. And I had no intentions of doing it again. But when COVID hit, it was kind of one of those, oh, crap. Here we go again. And then I started looking at the regulatory pathway, the intellectual property. You know, there's a pathway, there's kind of a recipe, because I thought, well, maybe this is a crazy idea. And I ran it by some people and they're like, you're nuts. Nobody's going to stick anything up their nose. And I said, well, they stick their finger up their nose every day. So let's retire the finger,
right,
and have a more sophisticated, effective way to do this. So that's kind of how it started. And then we formed the company and it's been unbelievable. We have well over 30% growth month over month. It's just like this. Yeah. And it's very effective against allergies. It's incredible. Oh, wow. And I've had a chance to like open up this whole new Pandora's box of ENT.
That's incredible. And how fun, because it's a new, not a new world, but, you know, it's a new specialty where, you know, your imagination gets to play fresh because you've done so much in women's healthcare and so much in surgery. So that's got to be invigorating for you to tap this new market.
It is. I love it. And sneak peek, we also have something to follow in the women's healthcare sector that's going to be similar.
Oh, awesome.
Peek. Yeah.
Oh my goodness. I'm so excited to hear more about that. Maybe we need a round 2 at that time, Dr. Gail.
Maybe.
So, so first I'm now imagining like, okay, what was the first iteration of NasaCleanse like? I'm imagining like, did it sit on the nose? Was it like a flash of light? Like what was the sort of first engineered concept and how did it change?
I don't have it handy, but if I can dig it up, I can send you some pictures. It's really funny. It was, I was trying to make it, you know, like I said to them, let's try to make it, you know, as natural as possible, blah, blah, blah. So they kind of had this big blob of wool on a stick. Like, what are those things called? A scrubby thing.
Oh, like a pot cleaner? Like a bottle cleaner?
Wool.
Bottle brush?
Yeah, something like that.
Steel wool.
I'm like, no, that's not going to work.
Oh yeah, it's all in the design.
It's all in the design.
And though you mentioned, okay, betadine that they were using in the nose was like 60%. Do you know, has your team seen, you know, what sort of result it looks like when they use a NasaCleanse?
So that's a great question. We do know in allergies, it'll reduce severe congestion, dry, itchy nose, that kind of thing in 84% of patients. Just using it twice a day.
Where were you when I was growing up?
I know.
Allergies have plagued our family for decades. And in fact, my boys both have them. So we're going to have to try this out.
Oh, we'll send you some.
Oh, thank you. In Spokane, we have a season where there's this sort of release of pine pollen. So anybody here who's tuning in from the Pacific Northwest will attest. There's a week when everything is coated in like a neon green dust. And you know,
yellow sage down here.
It's brutal.
Well, then it won't surprise you that 155 million people in the US every year are looking for nasal relief products.
Mm,
So, that's part of the research that I do on the front end. Like, do we really want to do this? Is this really a crazy idea? Because I have to ask that question,
right.
And then the
All
deeper I
part of,
went, and still every day I find out more and more about how important the nose is and how we've overlooked it. We've just it's in the center of our face.
right. And why we haven't had a solution like this before when we're all, I mean, allergies are no stranger to most of us. So this is phenomenal. And
Thank you.
do you think that the, I asked this question actually, I think to Keith as well. So when it comes to creating new products, do you find that when you start to create another product or work with a team and then establish a company and then you sell it, you've got this wonderful track record of releasing really innovative, actually useful, completely different products? Is it a muscle? Or is it, what does that feel like for like the next few? Because I imagine getting that first or second product off the ground must have felt like incredible, but also an incredible lift and maybe a little scary because it was new. So now is it the same, or is it more like this muscle you've built and you can kind of see the trajectory and you can just vet, hey, this is going to fly, this is not. Is it easier now?
Easier is not the way I would describe it, but I would say yes. Innately, I would say yes, because over time you develop experience, right? So,
Yeah.
but it's hard every time. It's hella hard work, it's
Yeah.
16-hour days, it's 7 days a week, but it's fun. And this is a completely new thing. We actually designed this to go down the path on the clinical side because that's what we're familiar with, right? And we have an entire line of clinical products, nasal cleansers and lubricants to use before scopes, like before doing, nasopharyngoscopy. We have that whole thing. But again, COVID hit. So let's not forget, we developed this during COVID. Supply chain issues. We did, everything. All of our products are made in the US for that reason. We make everything, locally. We do all the packaging ourselves.
Love it.
Yeah. But what I was going to say is it easier? Boy, that's a hard question. There is a little bit of a recipe, but we're learning. And I know what I was going to say. We developed this going down the clinical path, but we started getting calls from independent pharmacies and consumers. We were like, I want this for my allergies. I want this, I'm going on a plane. People who work in difficult environments where the air is dry, like pilots, flight attendants. And so we flipped our model on its head. And this is something that you have to be able to do as an entrepreneur. You have to be flexible. You cannot dig your heels in on a design, on a pathway, on anything. You have to be ready to change on a dime and willing, because otherwise you will not be successful. Sorry. I think it's just the truth.
I think that's so brilliant. Most people who develop products, myself included, when I started business and started launching offerings, I was absolutely married to what I was going to offer people. I thought I knew all their problems because I had the same, so I was making products for me back when I was having it, a rocky career path. So I was like, this is what I needed. And it was a learned skill to become flexible in the way that you're talking about.
You have to be very open-minded. Because you're going to get feedback and you can't push back. You can't go, no, you have to listen. You have to really listen. So we flipped everything on its head. We had medical device salespeople lined up, ready to go into the clinic and everything. But we repackaged, we redesigned our packaging. We realized the same product could be used for the consumer. And we've been very successful on the consumer side. And I think the clinical side will come second. It's kind of the opposite of what we normally would do. So the clinical side will come, but we need a lot more clinical work to be done first, clinically based evidence, getting in there, doing a surgical study. Back to the betadine. We mentioned betadine early on. Betadine kills the cilia in your nose. Ooh. Little known fact. So you cannot use it every day. You should not use it every day. And it has iodine, so some people are allergic to that. Right. We wanted something that was gentle and that actually was designed for the nose, not like, let's take another product off the shelf and use it in the nose. Mm-hmm. So anyway, that's my foray into ENT for the moment. It's great. I love it.
Oh my gosh, I absolutely love it. I think that there is a really special blend of expertise and talent that you have for doing this. And I cannot wait to hear what you are going to do next in the women's health sector with that's kind of in the same vein. So how exciting. I'm sure everyone here, if you have not followed Dr. Lebovic yet, please make it your first order of business today. I demand it. Go find her on LinkedIn, follow her. She's doing great things in this industry. And just from today, a couple things that I've taken away is that when you were initially approached to develop a product or to start kind of like masterminding on these products, to stay open to those ideas and have that conversation. Because I think a lot of times where we feel like we have to come up with all the answers ourselves, sometimes it's so powerful just to have that group with their own talents to bounce off of each other. And it sounds like that was an absolute fit where you were able to go in, hit that blank wall with your notes and poke holes where you will, and really create something special as a team. And I love how you've mentioned your team a bunch just in this one conversation. And then the other thing I wanted to mention is I don't want to glaze over this piece, because you mentioned being flexible, but also that comes with listening deeply to your customer or your target. So it reminds me a lot of people listening to this podcast today are in the job market, or they're laid off, or they're looking for their next startup where they can go and be that visionary, or work with those engineers, or work with incredible surgeons like yourself, creating these products. Like, what I would say to you is go in with that open mind, because a lot of times if we bring in our preconceived notions, we can block ourselves from the opportunity in front of us and the great ideas of others. So I love your open-mindedness. I am so inspired by the vision that you have and all the things you've done in healthcare. And I'm sure one day we'll be doing this podcast and you'll be telling me about the 100th company that you've sold. No. But for those who are as inspired as I am, Dr. Lebovic, where can they learn more about NasaCleanse and connect with you and your team?
Well, thank you so much, Claire, for all those comments. You can find me on LinkedIn, which is the only social media I do personally, but also at info@nasocleanse.com. You can get me there.
Awesome. Thank you so much. You guys, we will link all of this in the comments. Seriously, Dr. Gail, I cannot thank you enough. I would love to do a second interview with you when that new product comes out, and we cannot wait to follow the success of NasaCleanse. And personally, I can't wait to try it out as well with my kids, because we've just resigned ourselves for the first month or two of school that we're just going to be sick for like 6 days in a row. So I can't wait to see this just have an impact in our family as well. So we just are so grateful to have you. It's inspiring what you're doing as an entrepreneur and a claims surgeon. And for everyone who's tuned in today, thank you for spending the time with us. And make sure you follow Dr. Gail, and we'll see you next time on today's Medical Sales Leader. Thanks again.
Thank you.